Dolores, now that I'm done with the assessment of your mouth, I'm going to tell you what I found, and after that, I'm going to address your main chief complaint. Today, you present with a lot of soft buildup on your teeth and moderate amount of hard buildup on your teeth, mainly in the area between the contacts of your teeth. Your gums don't look healthy. They show signs of gingivitis, which is a mild form of gum disease. I'm going to give you a mirror so you can see it. See, Dolores, how your gums are inflamed, red and swollen, especially along the gum line? I put pink disclosing solution on your teeth, which stick to plaque, and it helps to see areas of your teeth that you aren't brushing enough. As you can see, the areas along the gum line have a lot of pink, and this buildup, which we call dental plaque, is a sticky film that forms on teeth and bacteria in the mouth mixed with sugary or starchy foods. This bacteria in plaque produce acids, and these acids can adhere to your teeth because of plaque stickiness. And when the acid sticks to your teeth, it breaks down enamel, setting the process of tooth decay, and the same bacterial acid that destroys tooth enamel can start an infection of the gum tissues, which we call gingivitis. But gingivitis can progress into severe gum infection, which we call periodontitis, which cannot be cured and eventually leads to tooth loss. After you eat food is when most acid production occurs. So every time you eat a meal or snack, your teeth are prone to plaque buildup within a few minutes. Regular and efficient tooth brushing and flossing can get rid of plaque. But if the plaque is not removed, it hardens into tartar, which we call calculus, and the more plaque adheres to your teeth, the more tartar will form, which is much more difficult to remove. In fact, tartar can only be removed by a dental hygienist. This is why it is so important to come see a dental hygienist regularly. Fighting plaque by effective oral hygiene practices and regular dental visits is the most critical factor in protecting and preserving your teeth, gums for a lifetime. You said that you haven't been to dentist in 5 years, but I'm so glad you're here today because gingivitis is totally reversible form of gum disease, and we caught it right on time before it progressed into more advanced phase of gum disease like periodontitis, which is non-reversible. I would like to show you what happens with periodontal disease. See, here we have a healthy tooth and gum tissue. The gums are very pink. And see here we have plaque that adheres along the tooth and gum line and which causes inflammation around the tooth. And on this first stage of gum disease, which is known as gingivitis, gums become red, swollen, and bleed easily because the body constantly tries to fight the bacteria that are right along the gum line. And if the plaque and tartar settle at the gum line underneath, the gum's bacterial toxin eventually will start to attack the bone and ligaments surrounding the tooth, which causes a more advanced phase of gum disease like periodontitis, and this person eventually will lose the tooth. Dolores, right now, what you have is a second stage, gingivitis. What we're trying to do right now to get you back to a healthy stage. But if you don't get gingivitis under control soon, it might progress into a periodontitis. And that's what we're trying to avoid. Dolores, now I would like to show you a very effective method of brushing that removes plaque very efficiently and provides stimulation to the gums so you can get your gums into a healthy state within 2 weeks. Dolores, I want you to hold the toothbrush parallel to your teeth and tilt the brush to a 45-degree angle so the bristles are slightly under the gum line. And with the gentle pressure, brush back and forth, not pushing too hard, using circular motion, and flick it down, just like this. Brush 15 to 20 times before moving to the next area. And don't forget to clean all surfaces of the teeth, especially the back side of the teeth, using the same motions. A lot of people don't even brush this area, and this disclosing solution that I put on your teeth show a lot of plaque accumulation in this area, in the back side. And when you brush lower teeth, brush away towards the top teeth, like this. And when you brush the top teeth, you want to brush down. And when you brush the front teeth, a lot of people do this, but it's not ideal. I want you to hold the toothbrush in vertical position behind your front teeth and brush up and down Also using circular motions and brush away like this. It's very important to brush all your teeth and all surfaces in this way, including the outer, the inner, and the top surfaces of your teeth. And brush your teeth for at least 2 minutes. You can divide your mouth in 4 quadrants and brush each quadrant for at least 30 seconds. Dolores, now I would like to give you a toothbrush and see if you can show me this toothbrushing method I just demonstrated, because I want to make sure you really know and remember how to brush your teeth correctly at home. Here's a toothbrush, let's try it. Good job, Dolores. This is exactly how I want you to brush your teeth. A lot of people don't know, but our tongue can also harbor bacteria, which often leads to bad breath. Brushing your tongue gently from back to front a few times with a toothbrush and toothpaste is an easy first step, since you're already in there brushing your teeth twice a day anyway. But there is a special tool made specifically for the tongue. It's called tongue scraper. Scraping can do a better job at removing the plaque and bacteria off the tongue surface. So how you gonna use it? You will stick your tongue out and apply pressure to run the scraper across the entire surface of the tongue once or twice, starting all the way at the back of the tongue and scraping toward the front. It should not hurt or do any damage to your tongue, and if it does, you're pressing too hard on the scraper, so use less pressure. And at the end, you're gonna rinse the scraper in warm water after each pass, and finish by rinsing it again and swishing your mouth out with water. Intraoral conditions are the cause of 80 to 85% of all bad breath cases. Mechanical removal of plaque and microorganisms is the first step in control of bad breath. Dolores, when it comes to toothbrush, the best to use a soft bristle toothbrush. And you mentioned that you use a manual toothbrush and occasionally electric toothbrush, but you don't use it as much because electric toothbrush make your gums bleed more and you fear that it may damage your gums or teeth. I suspect you just put more pressure that is needed, and I will show you how to properly hold your electric toothbrush. If you're one of those people who brushes hard, instead of holding your toothbrush like this with whole hand, you're gonna hold it with 3 fingers, and this way you are going to apply the right amount of pressure without fear that you can damage your teeth or gums. And a lot of electric toothbrushes nowadays have pressure sensor that will light up red or another color when too much pressure is applied, and you can actually hold the same way your manual toothbrush. It is possible to brush your teeth effectively with manual toothbrush. However, scientists found that people who use an electric toothbrush have healthier gums, less tooth decay, and also keep their teeth for longer compared to those who use a manual toothbrush. Electric toothbrushes, especially those with heads that rotate in both directions or oscillating heads, what I have right now here, are really effective at removing plaque, and I'm going to show you right now how to use it. I have an electric toothbrush here. I'm gonna place it at 45-degree angle, just like I did with manual toothbrush. And the half of their toothbrush have to be on the tooth and another half on the gums. A lot of people make a mistake by brushing only the top part of the teeth and a little bit sides, and never really touch the area between the gum and the tooth. And this is where the most plaque accumulates. So we want to be at 45 degrees right here. And my toothbrush has 2 spades, and I'm gonna show you right now. See, I'm gonna place a toothbrush on the back tooth and spend 2-3 minutes at least at each tooth before I move on to the next tooth. And the good thing about electric toothbrush that it does a lot of circular movements for you, versus manual, you have to do it yourself like this. So this is a benefit, and it does a good job, a better job at cleaning teeth than a manual toothbrush. Whether you choose to use an electric toothbrush or manual toothbrush, remember, what's most important is using the right brushing technique, the one that I showed you, and to brush all your teeth for at least 2 to 3 minutes, which means you will want to spend at least 2 to 3 seconds on each surface of the tooth. And the key here is circular movement and covering the tooth and the gum, and sweeping away if you choose to use a manual toothbrush, or if you use an electric toothbrush. Sometimes I just turn it off and just use this sweeping away motion. Whether you choose to use an electric toothbrush or manual toothbrush, remember, what's the most important is to using the right brushing technique, the one that I showed you, and to brush all your teeth for at least 2 to 3 minutes, which means you will want to spend at least 2 to 3 seconds on each surface of the tooth. The key here is circular movement and covering the tooth and the gum. And as you can see, the toothbrush can get in between the teeth, so flossing in between the teeth at least once a day is must. And right now I'm going to show you how to properly floss in between your teeth. When food gets stuck in these gaps between teeth, it creates a breeding ground for bacteria to build up, creating plaque. This is where floss comes in handy as interdental cleaning tool. It can get into these tight spaces and remove 80% of plaque. What I like to do, I take arm length of floss and roll it in between my two hands using 2 fingers and kind of clamp it like this using my thumb on both sides. And I go in between teeth and try to C-shape my floss. A lot of people think that they have to just go up and down like this, but the truth, you want to C-shape the floss and go like this. C-shape each tooth and use a clean piece of floss for each tooth, like this, kind of around the tooth, so you can get the most bacteria out of there. Dolores, here are my 2 favorite dental flosses. I would like you to try them right now so I can see if you remember how to floss properly at home. Please, let's try it. The choices for dental floss products on the market seem overwhelming, but you cannot go wrong with the choice of floss as long as you use it every day and use it properly with the method of C-shaping the tooth. And I would like you to floss first, then brush your teeth. Flossing before brushing is the most efficient for thorough removal of dental plaque. And please make sure you change your toothbrush every 3 months, because after we brush our teeth, bacteria and plaque inhabit our toothbrush. The longer we use it, the more buildup of plaque and bacteria accumulates on it, increasing our risk of developing gum disease or bad breath. Megan, given the fact that Dolores has a plaque-induced gingivitis, which is an inflammatory response of the gingival tissues resulting from bacterial plaque accumulation located at and below the gingival margin, I chose to teach her best method of brushing because it is the most accepted and effective method of the removal of dental plaque at the areas at the gingival margin and the caul, which are the most important areas in the control of gingival and periodontal infections. This type of circular brushing also provides a good gingival stimulation, which Dolores can benefit from. I showed this method of brushing using both manual toothbrush as well as electric toothbrush. I explained her that electric toothbrush proven to be a better option at plaque removal. I chose dental floss among other interdental tools because it's cheap, easy to use, and I would like her to use a clean floss every time she flosses, versus other interdental products are more expensive and made to use multiple times, so they have potential to harbor bacteria, and dental floss has ability to maneuver around any tooth and great for fitting into really tight spaces. I offered Dolores to use tongue scraper as a choice to control her bad breath, although what's been published so far describes tongue scraping as temporarily effective for bad breath. However, tongue scraper can help to eliminate not only debris but harmful bacteria of the tongue, which can help to prevent plaque and tartar buildup, cavities, as well as gum disease. I said, Dolores, that regular dental cleanings are essential part of good oral hygiene. Besides keeping the teeth and gums healthy, regular dental cleaning allows dentists to look at what's going on with the teeth so that issues like cavities or gingivitis can be treated early. And tartar doesn't respond to brushing or flossing. Only dental hygienists can remove tartar from the teeth. And once the substance builds up on the teeth, the patient becomes susceptible to a variety of oral diseases. That's why it's so important to come see a dental hygienist regularly.